If you're early in pregnancy and you've noticed spotting, I want you to. Seeing blood at this stage can feel terrifying, especially when all you want is a healthy pregnancy and a safe baby. But here's something incredibly important to know. Spotting in early pregnancy is common, and in many cases, it does not mean that anything is wrong. In this video, I'm going to calmly walk you through what spotting can, when it's considered normal, when it's a sign to call your doctor, and what you can do right now to take care of yourself while you wait. You are not alone in this, and having the right information can make all the difference between panic and peace. If this kind of guidance brings you comfort, please like this video, subscribe to the channel, and turn on notifications so you don't miss our weekly pregnancy and reproductive health video. Let's talk about spotting in early pregnancy clearly, honestly, and without fear. Spotting during early pregnancy is one of the most common experiences among newly pregnant individuals, yet it is also one of the most misunderstood. Many people immediately associate any amount of blood with danger, loss, or failure, even though the body is undergoing rapid and complex changes during this stage. The uterus, cervix, and hormonal environment are adapting to support a growing pregnancy. These adjustments often involve increased blood flow, tissue remodeling, and shifts in hormone levels, all of which can naturally result in light bleeding or spotting. For many pregnancies, spotting is simply a sign that the body is responding appropriately to implantation and early development. It does not automatically signal harm to the embryo or a problem with the pregnancy's progression. Fear often arises because spotting feels unexpected and contrasts sharply with the idea that pregnancy is symptom-free. In reality, early pregnancy is dynamic, not static, and variability is normal. Medical research consistently shows that a significant percentage of healthy pregnancies include some degree of spotting, especially in the first trimester. Understanding this helps reframe spotting not as a failure, but as a possible part of a normal biological process. Early pregnancy is a time when emotional vulnerability is heightened, and spotting can amplify fears rooted in uncertainty. Many people are still adjusting to the idea of being pregnant when spotting occurs. This emotional response is valid, but it is important to distinguish emotional fear from medical risk. Light spotting without pain, clots, or progression often falls within normal parameters. Healthcare providers frequently reassure patients that spotting alone does not predict pregnancy outcome. It is one data point among many, not a definitive diagnosis. The body's communication during early pregnancy can be subtle and spotting is one of those signals that requires context rather than immediate alarm. When patients understand how common spotting is, anxiety often decreases, allowing for clearer thinking and better decision-making. Knowledge becomes a stabilizing force during an otherwise emotionally charged moment. Biologically, early pregnancy involves the formation of new blood vessels to support the developing placenta. These vessels are delicate and can bleed easily. Even small disruptions, such as physical activity or hormonal fluctuation, may cause light bleeding without affecting the pregnancy itself. Spotting may appear as pink, brown, or light red discharge, and its appearance can change from day to day. Color variation alone does not determine whether spotting is normal or concerning. Duration, volume, and associated symptoms matter more. Many healthy pregnancies involve brief episodes of spotting that resolve without intervention. Recognizing this helps prevent unnecessary panic and encourages appropriate monitoring instead. Cultural narratives often portray pregnancy as fragile, reinforcing the idea that any symptom equals danger. This perception can intensify fear around spotting. Medical evidence, however, paints a different picture, one where early pregnancy is resilient and adaptable. Spotting does not mean the body is failing. It often means the body is adjusting. Understanding this distinction helps reduce self-blame, which is a common emotional response among pregnant individuals experiencing spotting. No action taken by the pregnant person typically causes normal spotting. It is rarely preventable and almost never intentional. Removing blame allows space for calm observation and informed care. Spotting can occur even in pregnancies that proceed completely normally through full term. Many parents only learn after delivery that spotting was never a risk factor in their specific case. This delayed realization underscores how fear-driven early experiences often contrast with eventual outcome. Medical reassurance is not meant to dismiss fear, but to contextualize it. When spotting occurs, it is an invitation to gather information, not to assume the worst. Trusting the process does not mean ignoring symptoms. It means responding thoughtfully. Healthcare providers assess spotting using multiple factors, including timing, quantity, and associated pain. Light spotting early on, especially without cramps, often falls into a low-risk category. This does not mean follow-up is unnecessary, but it does mean panic is not required. Most providers encourage patients to report spotting calmly and track. Clear communication helps providers guide care appropriate. Calm responses support both emotional well-being and physical health. Narrative Block 7. One of the greatest challenges in early pregnancy is tolerating uncertainty. Spotting introduces uncertainty at a time when reassurance feels most needed. Understanding that spotting is common can transform fear into patience. Allows the body time to declare its course without immediate intervention. This mindset does not deny risk. It balances it with probability. Probability strongly favors healthy outcome. Many people fear that acknowledging normal spotting will cause them to miss danger signs. In reality, education sharpens awareness rather than dulling it. Knowing what is common helps identify what is truly concerning. This distinction empowers pregnant individuals to advocate for themselves effectively. Informed awareness is protective, not dismissive. It strengthens confidence during early pregnancy. Early pregnancy symptoms exist on a spectrum, and spotting occupies a wide range within that spectrum. Some experience none, others experience brief, and some experience recurrent light spotting. All of these scenarios can still result in healthy pregnancy. The presence or absence of spotting does not define pregnancy success. Each pregnancy follows its own pattern. Comparisons often increase anxiety rather than clarity. Ultimately, spotting is a symptom, not a verdict. It deserves attention, but not automatic fear. When viewed through a medical and compassionate lens, spotting becomes understandable. Understanding reduces anxiety, which benefits both mental and physical health. Early pregnancy requires both vigilance and gentleness. Spotting reminds us that both can coexist. One of the most powerful tools in early pregnancy is knowledge, especially when it comes to interpreting symptoms like spotting. Not all bleeding is the same, and learning the differences can dramatically reduce. Normal spotting is typically light, brief, and not accompanied by severe pain. Concerning bleeding is often heavier, persistent, or associated with cramping, dizziness, or clots. Understanding these distinctions helps guide appropriate responses. Clarity replaces panic when information is available. Anxiety thrives in ambiguity, and spotting often feels ambiguous. Education turns ambiguity into discernment. Knowing what questions to ask and what details matter provides emotional grounding. This allows pregnant individuals to communicate more clearly with healthcare providers. Clear communication leads to better care decisions. Better decisions reduce emotional distress. Normal spotting often resolves on its own without intervention. Concerning bleeding usually escalates rather than fades. Tracking changes in flow, color, and duration offers valuable insight. Patterns matter more than isolated moments. This observational approach encourages calm monitoring. Monitoring does not mean ignoring. Fear-driven reactions can sometimes delay appropriate care or increase stress unnecessarily. Understanding warning signs ensures timely action without overreaction. Balance is essential in early pregnancy. Knowledge supports that balance. It allows space for reassurance while staying alert. This dual awareness protects both mental and physical health. Many people regret not learning these distinctions earlier in pregnancy. Early education builds confidence that lasts throughout gestation. Confidence reduces stress hormones, which benefit pregnancy overall. Emotional calm supports physical well-being. Information becomes a form of prenatal care. It is proactive, not reactive. Healthcare systems function best when patients are informed participants. Understanding spotting empowers patients to seek help appropriately. This improves the quality of care received. Providers can act more efficiently when symptoms are clearly described. Clarity saves time and reduces uncertainty. This partnership strengthens outcome. Distinguishing between normal and concerning symptoms reduces unnecessary emergency visits. It also ensures urgent cases receive prompt attention. This benefits both individuals and healthcare systems. Education aligns response with actual risk. Risk assessment becomes clearer. Fear becomes manageable. Pregnancy education is not about memorizing, but about understanding patterns. Spotting patterns offer insight into what the body is doing. Learning these patterns increases trust in one's own awareness. Trust reduces dependency on constant reassurance. This fosters emotional resilience. Resilience supports the entire pregnancy journey. Calm decision-making requires emotional regulation. Understanding symptoms supports emotional regulation. When fear decreases, thinking becomes clearer. Clear thinking leads to better choices. Better choices reduce regret. Regret is often rooted in panic, not facts. Ultimately, understanding spotting transforms fear into informed awareness. Awareness empowers action without panic. Calm decisions protect both physical health and emotional stability. This knowledge is not just reassuring, it is practical. It equips pregnant individuals to navigate uncertainty with confidence. Confidence is one of the most valuable tools in early pregnancy. Early pregnancy involves profound hormonal and anatomical changes that prepare the body to support new life. These changes do not happen silently. They often come with physical signs, one of which can be light spotting. Implantation bleeding is one of the earliest and most common explanations. It occurs when the embryo attaches itself to the uterine lining, a process that can slightly disrupt small blood vessels. This type of spotting is usually light, short-lived, and often appears around the time a menstrual period would normally occur, which can be confusing. Cervical sensitivity is another natural contributor. As pregnancy hormones increase, the cervix becomes softer, more vascular, and more prone to light bleeding. Even gentle stimulation, such as intercourse or a pelvic exam, can trigger spotting without harming the pregnant. These processes are physiological responses, not signs of dysfunction. Hormonal shifts in early pregnancy are dramatic and constant. Estrogen and progesterone levels rise rapidly to sustain the uterine environment. These hormones increase blood flow to the reproductive organs, including the cervix and uterus. With increased blood flow comes increased fragility of small blood vessels. This fragility explains why spotting can occur with minimal or no provocation. The body is not malfunctioning, it is adapting. Understanding this helps normalize the experience rather than pathologize it. Implantation is a complex biological event that involves communication between the embryo and the uterine lining. This interaction allows the pregnancy to establish a blood supply necessary for growth. Minor bleeding during this process reflects tissue remodeling, not rejection. It is often described as pink or brown discharge and usually resolves quickly. Many people experience implantation bleeding without ever realizing what it was. Later reflection often reveals it as an early sign of a healthy pregnancy. Cervical sensitivity tends to persist throughout the first trimester and sometimes beyond. Because the cervix contains many small blood vessels, it responds quickly to physical contact. Spotting from the cervix is typically painless and self-limited. It does not indicate uterine bleeding or fetal distress. Healthcare providers often identify the cervix as the source during evaluation. This reassurance helps patients understand that not all bleeding comes from the uterus. Hormonal fluctuations can also cause what is known as breakthrough. This occurs when the uterine lining responds to changing progesterone level. Breakthrough bleeding can be darker and last slightly longer than implantation spotting. It can be mistaken for a period, especially early in pregnancy. Despite its appearance, it does not necessarily indicate pregnancy failure. It reflects the dynamic nature of early gestation. Many people assume that a healthy pregnancy must be symptom-free. In reality, symptoms often reflect healthy adaptation. Spotting, when light and self-limited, can fall into this category. The absence of pain, heavy flow, or clots is reassuring. Medical evaluation is still important, but panic is not required. Information transforms uncertainty into understanding. These natural causes of spotting are they may appear once or recur intermittently without progression. Most resolve without intervention or long-term consequence. the pregnancy continues to develop normally. This pattern is seen repeatedly in clinical practice. Experience and research both support this understanding. It is important to separate natural spotting from dangerous conditions. Natural causes tend to be mild, predictable, and self-resolving. They do not worsen rapidly or cause systemic symptoms. Learning these distinctions reduces emotional distress. Calm observation. Confidence grows with understanding. Education empowers pregnant individuals to respond appropriately. Knowing that implantation, cervical sensitivity, and hormones can cause spotting reduces fear. Fear often stems from the unknown, not from the symptom itself. When the cause is understood, anxiety decreases. This emotional relief benefits both mental and physical health. Knowledge is a form of reassurance. Early pregnancy is a period of adjustment, not perfection. Spotting can be part of that adjustment. Recognizing normal causes prevents unnecessary worry. It allows space for trust in the body's process. Medical care remains important, but fear does not have to dominate. Understanding brings calm to uncertainty. One of the most persistent fears surrounding spotting in early pregnancy is miscarriage. This fear is deeply emotional and often tied to uncertainty, past experience, or long-awaited pregnancy. However, spotting alone does not equal pregnancy. Many pregnancies with first trimester bleeding progress normally. Medical data consistently shows that bleeding can occur without negative outcome. Separating symptom from outcome is essential. Miscarriage is relatively common, but it does not always present with spotting. Likewise, spotting does not always precede miscarriage. These two experiences overlap, but they are not synonymous. Only a portion of miscarriages involve early bleeding. Most people who experience spotting do not go on to miscarry. Understanding probability helps reduce fear-driven assumption. Clinical studies show that up to 25 to 30% of pregnancies involve first trimester spotting. The majority of these pregnancies result in healthy births. This statistic alone challenges the belief that spotting equals danger. Medical professionals rely on patterns, not isolated symptoms. Spotting becomes meaningful only when evaluated in context. Context includes timing, amount, pain, and progression. Emotional responses to spotting often outpace medical risk. Fear can escalate quickly, especially in early pregnancy. This emotional surge is understandable, but not always aligned with reality. Medical reassurance aims to realign perception with evidence. Evidence shows resilience, not fragility, in many pregnancies. Understanding this fosters emotional balance. Some people experience significant bleeding and still carry healthy pregnancies. Others experience no bleeding and still face complications. Pregnancy outcomes are influenced by many factors. Spotting is only one piece of a complex. Focusing solely on spotting can distort perception. A broader view provides clarity. Healthcare providers evaluate miscarriage risk using ultrasound, hormone levels, and symptoms combined. Spotting alone rarely provides enough information. This is why follow-up evaluation is emphasized. Waiting for confirmation can be emotionally difficult. However, premature conclusions often increase. Patience allows facts to emerge. Self-blame is a common response to spotting. Many people wonder if they caused it through activity or stress. In most cases, this is unfounded. Normal spotting is not caused by behavior. Removing blame is critical for emotional health. Compassion toward oneself supports healing. Fear of miscarriage can overshadow the pregnancy. Education helps restore balance. Knowing that spotting is often benign allows room for hope. Hope does not deny risk. It acknowledges probability. Probability favors healthy outcome. This perspective supports emotional resilience. Medical guidance focuses on monitoring rather than immediate conclusion. Spotting prompts observation, not automatic diagnosis. This approach protects against unnecessary intervention. It also prevents emotional exhaustion. Trust in the process is encouraged. Support remains available throughout. Spotting is not a verdict on pregnancy outcome. It is a symptom that deserves attention, not assumption. Many healthy pregnancies include early bleeding. Understanding this truth reduces fear. Fear replaced by knowledge becomes manageable. Knowledge supports calm, informed care. Early pregnancy is marked by precise developmental transitions that occur at specific weeks. These transitions are necessary for the pregnancy to continue developing normally, but they can also make spotting more likely. Around week 7, one of the most significant hormonal shifts occurs. This is when progesterone production transitions from the ovaries to the developing placenta. Progesterone is essential for maintaining the uterine lining and supporting pregnancy stability. Even slight fluctuations during this handoff can lead to light spotting. This spotting does not mean progesterone is insufficient. It reflects a temporary adjustment. The body is recalibrated, not failing. Understanding this timing helps explain why spotting often appears suddenly around this stage. The ovary initially supports pregnancy through the corpus luteum, which produces progesterone. As the placenta matures, it gradually assumes this role. This transition is biologically complex and not always seamless. Small hormonal dips may briefly affect the uterine lining. This can result in spotting without threatening the pregnancy. Many people experience this and go on to have completely healthy pregnancy. The second common time for spotting occurs between weeks 10 and 12. During this stage, maternal-fetal blood flow becomes established. Before this point, the placenta limits direct blood exchange. As circulation increases, fragile blood vessels may bleed slightly. This is another normal developmental milestone. Spotting at this stage reflects growth, not danger. These developmental changes are invisible but impactful. The body is constructing complex to sustain the pregnancy. Minor bleeding can occur as part of this construction. This does not indicate instability. It indicates active development. Understanding this reduces fear during these critical windows. Spotting related to developmental changes is often, it may resolve without intervention. It typically lacks severe pain or heavy. These features distinguish it from more concerning causes. Healthcare providers recognize pattern recognition guides reassurance. Pregnancy development is not linear or predictable day to day. It involves phases of rapid change. These phases can temporarily increase symptoms. Spotting is one such symptom. This variability is normal. Expecting constant stability can increase anxiety. Research supports these observed timing patterns. Large studies show clustering of spotting episodes around this consistency across populations strengthens understanding. It reassures patients that they are not alone. Shared patterns normalize individual experience. Science provides context for fear. When patients learn about these developmental stages, anxiety decreases. Timing becomes explanatory rather than alarming. Spotting becomes understandable rather than mysterious. This knowledge supports emotional regulation. Calm responses improve overall well-being. Emotional calm supports physical health. Not all spotting aligns perfectly with these windows. However, many cases do. Recognizing typical timing helps frame expectation. It allows for informed conversations with providers. Preparedness replaces panic. Confidence replaces fear. Developmental changes are signs of progress. Spotting during these changes often reflects adaptation. Understanding this reframes the experience. Early pregnancy is dynamic. Symptoms reflect movement, not stagnation. Growth can be uncomfortable but purposeful. Scientific research provides reassurance that personal experience alone cannot. Large-scale studies allow patterns to emerge beyond individual cases. One such pattern is the prevalence of first trimester bleeding. Approximately 25% of pregnancies include some bleeding. This statistic challenges the belief that bleeding is rare or abnormal. Normalizing prevalence reduces isolation. Importantly, most pregnancies with early bleeding continue normally. Bleeding does not automatically predict miscarriage. Only a portion of miscarriages are preceded by bleeding. This distinction is critical. Correlation does not equal causation. Understanding statistics prevents misinterpretation. Research tracking thousands of pregnancies shows similar outcomes. Many participants experienced spotting at least once. The majority delivered healthy babies. These findings repeat across different populations. Consistency strengthens confidence in conclusion. Evidence replaces anecdote. Patients often overestimate the risk associated with spotting. This overestimation is driven by fear, not data. Research corrects these assumptions. Data provides grounding. Grounding reduces anxiety. Anxiety reduction improves decision-making. Understanding population-level data helps contextualize personal symptoms. Individual experience feels intense. Statistics provide perspective. Perspective does not minimize emotion. It balances emotion with reality. This balance is protective. Healthcare providers rely heavily on evidence-based medicine. Reassurance is not casual or dismissive. It is informed by research. Providers have seen these outcomes repeatedly. Experience aligns with data. This alignment builds trust. Fear often narrows focus to worst-case scenarios. Research broadens focus. It reminds patients of the most likely outcome. Likely outcomes matter more than rare ones. This shift calms emotional responses. Calm supports resilience. Population studies also help identify true warning signs. They clarify which symptoms require urgent evaluation. This distinction improves safety. It prevents unnecessary panic. It ensures timely care when needed. Education improves outcomes. Statistics should not be used to dismiss individual concerns. Every pregnancy deserves attention. However, data helps guide appropriate response. Response aligned with risk is optimal. Fear-driven reactions can be harmful. Information-driven responses protect health. Research reminds us that spotting is common. Common does not mean insignificant. It means understandable. Most pregnancies with early bleeding end well. This truth offers hope. Hope supports emotional well-being. One of the greatest sources of anxiety in early pregnancy is not knowing when a symptom is serious. Spotting alone can feel alarming, but uncertainty increases fear more than the symptom itself. Learning the warning signs shifts the experience from helpless to empowerment. When you know what truly requires urgent attention, you are less likely to panic unnecessarily. Heavy bleeding that resembles or exceeds a menstrual period is one of the most important warnings. This type of bleeding deserves prompt medical evaluation. Severe or worsening pain, especially when it is localized to one side of the body, is another signal that should never be ignored. Dizziness, fainting, or shoulder pain can indicate internal bleeding and require immediate medical care. Knowing these signs creates clarity instead of fear. Empowerment in pregnancy does not mean ignoring symptoms. It means responding appropriately based on evidence and guidance. Many people fear that if they stay calm, they might miss something serious. In reality, education sharpens awareness rather than dulling it. Understanding warning signs helps separate normal discomfort from urgent concern. This distinction allows pregnant individuals to trust themselves while remaining vigilant. Vigilance without panic protects both emotional and physical health. Calm awareness is far more effective than fear-driven reaction. Heavy bleeding is defined not by a few drops, but by volume and soaking through pads or passing large clots signals the need for evaluation. Pain associated with bleeding changes the clinical picture. Mild cramping can be normal, but intense or unilateral pain is not. The body often provides multiple signals when something requires attention. Listening to these signals early can prevent complication. Prompt care does not mean something terrible has happened. It means you are taking care of yourself. Early evaluation, protective, not alarming. Dizziness and fainting are symptoms that indicate systemic involvement, not just localized. These symptoms suggest that the body may be responding to blood loss or internal irritation. Shoulder pain, though surprising, can be referred pain from blood irritating the diaphragm. This connection is not intuitive, which is why education is critical. Understanding these signs allows for quicker action. Quick action saves lives in rare but serious situations. Knowing warning signs reduces unnecessary emergency visits for benign spotting. At the same time, it ensures that true emergencies receive immediate care. This balance benefits individuals and healthcare systems alike. Fear-driven decisions often lead to exhaustion and confusion. Informed decisions lead to confidence and clarity. Confidence supports emotional stability during pregnancy. Healthcare providers rely on symptom patterns to assess risk. Patients who understand warning signs communicate more clearly. Clear communication improves diagnostic accuracy. This partnership strengthens care. Empowered patients feel more supported. Support reduces stress hormones that can affect pregnancy. Many people report feeling calmer once they understand what truly matters. Education replaces constant hypervigilance. This allows rest, which is essential in early pregnancy. Rest supports hormonal balance. Balance supports pregnancy progression. Peace becomes possible. Knowing warning signs does not mean expecting them. It means being prepared without fear. Preparedness brings peace of mind. Peace of mind supports emotional health. Emotional health supports physical well-being. This cycle is protective. Fear often thrives on the unknown. Knowledge illuminates the unknown. When warning signs are clearly defined, anxiety decreases. Clear boundaries between normal and concerning symptoms reduce stress. Stress reduction benefits pregnancy outcome. Calm awareness is a powerful. Warning signs are guides, not threats. They exist to protect you. Understanding them allows you to respond with confidence. Confidence replaces panic. Panic clouds judgment. Confidence clarifies it. Education turns fear into readiness. One of the most important messages for early pregnancy is this: your concerns are valid. Many people hesitate to call their doctor because they fear being judged, dismissed, or seen as overreacting. This hesitation can increase anxiety and delay care. Healthcare exists to support you, not to silence your worry. Calling your doctor is an act of responsibility, not weakness. Your intuition matters. Pregnancy is filled with new sensations, and it can be difficult to know what is normal. No one expects you to have all the answers. Medical professionals understand that uncertainty is part of early pregnancy. Your role is not to diagnose yourself, but to report changes. Reporting concerns allows providers to guide you appropriately. Communication is central to good care. There is no threshold of fear that must be reached before seeking help. If something feels different or concerning, that alone is reason enough to call. Early reassurance can prevent prolonged anxiety. Early evaluation can prevent complication. Both outcomes are beneficial. Waiting in silence rarely. Some people worry about bothering their provider. In reality, providers prefer early communication. Early communication allows for simple intervention. Delayed communication can complicate care. Your call helps providers help you. You are part of the care team. Calling your doctor does not mean something is wrong. It means you are engaged in your care. Engagement improves outcome. Patients who communicate feel more supported. Support reduces fear. Reduced fear improves pregnancy experience. Healthcare providers are trained to triage concern. They can tell you when to monitor and when to come in. This guidance brings clarity. Clarity reduces stress. Stress reduction benefits both parent and baby. Guidance replaces guesswork. Your emotional experience matters just as much as physical. Anxiety alone can be exhausting. Speaking to a professional can bring immediate relief. Reassurance is therapeutic. Feeling heard is powerful. You deserve that support. Some concerns resolve quickly after a phone call. Others lead to evaluation and reassurance through ultrasound or labs. Both outcomes are valuable. They provide information. Information reduces fear. Reduction improves well-being. You are never wasting time by advocating for yourself. Self-advocacy is a skill that strengthens throughout pregnancy. This skill benefits labor, delivery, and postpartum care. Learning to speak up early builds confidence. Confidence empowers informed decisions. Informed decisions support healthy outcomes. Your body is changing, and questions are natural. Your concerns deserve attention. Calling your doctor is always appropriate when something worries. There is no shame in seeking reassurance. Support is part of prenatal care. You do not have to navigate pregnancy. When spotting happens in early pregnancy, one of the hardest parts is waiting. Waiting for a callback, waiting for an appointment, or waiting for clarity can feel overwhelming. During this waiting period, having simple actions to focus on can restore a sense of control. These actions do not replace medical care, but they support both physical and emotional well-being. Rest is one of the most important steps. Slowing down allows the body to conserve energy during a time of uncertainty. Rest also calms the nervous system, which often becomes activated when fear arises. Lying down, elevating your feet, and minimizing physical strain can be deeply grounding. Grounding helps prevent panic from taking over. Hydration is another simple but powerful tool. Early pregnancy places increased demands on the cardiovascular system. Adequate hydration supports blood volume and circulation. When the body is dehydrated, symptoms like dizziness or fatigue can worsen anxiety. Drinking water regularly helps stabilize physical sensation. This stability makes it easier to interpret symptoms accurately. Hydration supports clarity. Using a pad rather than a tampon allows you to observe bleeding patterns safely. Tracking color, amount, and duration provides valuable information for healthcare providers. This information helps guide medical decisions. Tracking also gives you something constructive to focus on. It transforms passive waiting into active observation. Observation empowers rather than frighten. Avoiding vaginal intercourse or inserting anything into the vagina during active bleeding is often recommended. This reduces irritation to the cervix. It also prevents confusion about the source of bleeding. These temporary precautions support clarity. They are not permanent restriction. They are part of short-term care. Writing down symptoms can be especially helpful during emotionally charged. Stress can affect memory. Having notes ensures accurate communication with providers. Clear communication improves care quality. Preparation reduces fear, diminishes when you feel prepared. Simple steps create structure during uncertainty. Structure is calming to the nervous system. Calm improves emotional resilience. Resilience helps you tolerate waiting. Waiting becomes manageable. Manageable experiences reduce distress. These actions also reinforce self-care. Self-care is not indulgent during pregnancy. It is essential. Caring for yourself supports the pregnant. Support builds confidence. Confidence reduces helplessness. Feeling in control does not mean controlling outcome. It means controlling how you respond. Response matters. Responses support mental health. Mental health supports physical health. This connection is powerful. Small actions can have large emotional impact. They remind you that you are not powerless. You are participating in your care. Participation builds trust in yourself. Trust reduces fear. Reduction supports waiting is easier when you have tools. Rest, hydration, and symptom tracking are those tools. They provide stability during uncertainty. Stability supports emotional balance. Balance supports early pregnancy. Simple steps make a meaningful difference. One of the most isolating aspects of spotting in early pregnancy is the feeling that you are alone. Fear often convinces people that their experience is rare or abnormal. In reality, spotting is shared by many pregnant individuals across the world. Knowing this can bring immense relief. Shared experiences reduce isolation. Connection restores calm. Many people only learn how common spotting is after speaking with others or their healthcare provider. Stories of healthy pregnancies following early bleeding are abundant. These stories provide hope. Hope does not deny risk. It balances fear with reality. Balance supports emotional well-being. Information is a powerful antidote to understanding. What spotting can mean replaces imagination with knowledge. Knowledge reduces catastrophic thinking. Catastrophic thinking increases stress. Stress affects both mental and physical health. Reducing stress benefits pregnancy. Support can come from many sources. Partner, friends, family, and healthcare providers all play a role. Speaking openly about fears lightens emotional burden. You do not have to carry fear alone. Shared concern becomes shared strength. Strength supports resilience. Online communities and educational resources can also provide reassurance. Hearing others describe similar experience normalizes symptoms. Normalization reduces shame. Shame isolates. Connection heals. Healing supports emotional stability. Reassurance does not mean ignoring symptoms. It means contextualizing. Context allows for appropriate response. Appropriate response prevents panic. Panic clouds judgment. Calm supports clarity. Pregnancy is a journey filled with uncertainty. Uncertainty does not mean danger. It means adaptation. Adaptation is natural. The body is capable. Trust in that capability grows with support. Feeling supported increases confidence. Confidence improves coping. Coping reduces stress. Reduced stress benefits pregnancy outcomes. Emotional safety matters. You deserve emotional safety. Spotting does not define your pregnancy. It is one moment in a larger journey. This journey includes growth, change, and resilience. Many before you have walked this path. Many have emerged with healthy babies. This shared path offers reassurance. You are not alone in this experience. Information guides you. Support holds you. Reassurance steadies you. Early pregnancy can be frightening, but it can also be with knowledge and connection. Peace is possible.